Hi friends, welcome back to Coffee with Ravi. I've had to take a little longer break and thank you for the encouragement in this time period to keep putting these videos out. I know how many of you appreciate this and get something from it. On a separate note, before I get into it, we've been nominated on the Career Best of the Best medical offices. And I know that I did send out an email yesterday for you to take a few seconds if you are able to vote for that, if you so feel so. We would appreciate that. Today I thought I would talk about a common topic that our friends, children, grandchildren ask us about acne. What is acne and how do you treat it? I get a lot of questions about that, especially from children and kids around, that friends of my kids, in terms of what is acne. Acne is a inflammatory state around a skin follicle, and I'll tell you what a skin follicle is. And what happens is that then the skin follicle gets plugged up and inflamed, and then that causes these inflammatory changes which you see that can cause scarring, etc. Very common in adolescents and pre-adolescents, but can sometimes persist into adulthood. And there's a great financial impact as well as a psychosocial impact because it affects how we perceive ourselves. So if you look at this diagram of that skin unit that I have on the slide, the skin unit that we're looking at is a hair follicle. You can see the hair come out, but around the hair follicle are sebaceous glands which secrete the oily substance that's needed to lubricate the skin. This whole unit is called a pilosebaceous unit. And when I talk about the pore, it's the pore that's coming through which the hair follicle is then coming up. So the hair follicle sits, think about it like this plant. This could be the pilosebaceous unit, and this is the hair follicle that's coming out, and the opening of this is the pore. What's happening in acne is that there is sometimes more secretion of this sebum or sebaceous gland, or the oily secretion. The second thing that happens is that the lining of the skin is called keratin, and that's produced by this pilosebaceous unit, and sometimes there's excess formation of that. So when that happens, the pore gets plugged up by what's called comedo, or these whiteheads that we see. The third thing then that kicks in is that there's a bacteria called Propionibacterium acnes, which then causes infection in that hair follicle. That infection leads to inflammation. Inflammation is the redness, and then the redness and prolonged inflammation can sometimes cause scar tissue. So that's kind of that sequence of this why acne forms. Sometimes hereditary is a cause. Both male and female hormones can play a role. We'll talk a little bit about diet, and of course the bacterial species, and the main bacteria, as I said, is the Propionibacterium acnes. How do we treat it? It again goes back to the mechanism. What we're trying to do is eradicate the bacteria. However, if you put skin bacterial ointment alone, it doesn't seem to be working. There are substances called topical retinoids, and I have the names, adapalene, tretinoin, etc. And I put the brand names that you will recognize. The mechanism of these topical retinoids is that they prevent the comedo formation. In other words, they prevent the pore that we saw from getting plugged by these whiteheads. There's topical benzoperoxide, which sometimes acts as an antibacterial, but that alone probably is not helpful. And then oral antibiotics are sometimes used, mostly doxycycline, because it has both antibacterial and anti-inflammatory activity, but you don't want to use it for long term because from a gastroenterology GI standpoint, it changes the gut flora and can cause problems such as C. difficile, etc. In addition to, of course, just basic diarrhea that doxycycline causes. Hormone-based strategies can sometimes be used, such as oral contraceptives, etc., but that comes with a separate discussion as to the pros and cons of that, especially in young adults or adolescents. Sometimes the same retinoids that we're applying systemically to clean out the whiteheads can be taken orally, but they have certain properties where one cannot get pregnant on it, so you got to be very careful, especially when we're dealing with adolescents, etc. So the FDA has a whole monitoring system called iPledge, where where pregnancy prevention is given a lot of importance, and actually 2 forms of contraception are recommended so that you have the backup. So that's a whole separate discussion. What I see in mainstay people using is the topical retinoid type stuff, as well as oral antibiotics for moderate to severe acne. My son and daughter sometimes ask me, is there a particular diet that would help in preventing acne? And when I looked at the literature in trying to answer that question, there are very few high quality studies that can go and answer, because diet is such a big thing, and in terms of study of that area, it hasn't really been well studied. But whatever few good quality studies are there are 2 things that come out of that. Number 1, it's foods that have high glycemic index, in other words, that can shoot your blood sugar up. These are mostly processed foods. So if you're eating white bread, pasta, anything that has sweets, carbs, ice cream, things like that spike the blood sugar up, what that does is that it then raises the insulin level. The insulin is a hormone that goes up when the blood sugar goes up, and this seems to have this higher insulin levels have been implicated in many things, including acne, but the insulin levels then stimulate cell growth. And that's actually one of the mechanisms by which it's thought that cancer growth too is driven. So more and more I advise patients to eat low glycemic foods, which are more complex carbs such as beans. If you want to eat fruits such as berries are low glycemic index. Anything that has a lot of fiber that comes with the sugar is low glycemic index. Anything that's processed, automatically the glycemic index goes up. So therefore, high glycemic foods should be avoided in the context of acne, and perhaps for all of us from many other different standpoints. So therefore, in summary, what I wanted you to look at and understand is this pilosebaceous unit, or this hair follicle unit, and how that gets plugged, how that leads to how increased sebum production adds to it, how Propionobacterium acnes tends to grow in it, how that causes inflammation and that causes acne, and how you can prevent it. But you can take away certain other things for all of us, which is the how the link between high glycemic foods and how that drives cell growth, and can also drive cancer cell growth too, perhaps, is the thought process, because there's a connection that's being established there. So thank you for joining us. I hope you got something out of it. The goal for me in these sessions is to continue to add to the knowledge that's out there that you can use for your own health, and I know your encouragement continues to give me motivation to put forth these videos. And please don't forget about that Courier Best of the West link that I sent out yesterday.